I'll move on first to introduce then our first speaker. So we're really delighted to have Helen Deely here from the HSE. So Helen is Assistant National Director with the remit of Health and Wellbeing at the HSE, and she's going to speak to us today on Creating a Healthy Ireland, the Sláinte Care Healthy Communities, Healthy Ireland initiatives and their progress. So over to you, Helen.
And I am going to talk a little bit around creating a healthy environment, but more particularly I'm going to talk about the Sláinte Care Healthy Communities initiative, which is a Healthy Ireland initiative, and just tying in a few other pieces into that. So I'm going to talk to you for a minute about Ray. Ray lives in Tala, which is one of our Sláinte Care Healthy Community areas, and it's one of the areas of highest deprivation across the country. You'll see there in terms of red, and it's got quite a lot of pockets of red and very little blue in terms of housing estates. Ray's a long-term smoker, and he's been smoking for over 40 years. And because Ray is a man, he's 21% more likely to smoke than if he were a woman at 15%. Because he's unemployed, he's 38% more likely to smoke than someone who's employed at 18%. And because he's in a low-income group, he's 42% more likely to report having at least one chronic condition, compared to someone who lives in one of the highest income groups. So Sláinte Care Healthy Communities is really around looking at people who live in very high deprived areas and trying to tackle some of these health inequalities. It comes from the Government Healthy Ireland strategy, and the 4 key goals of the Healthy Ireland framework are set out there. And really it's around improving the health and population of the health and wellbeing of the entire population, and in particular around trying to address health inequalities. It's an overarching government strategy, so it's a cross-government strategy. And my unit within the HSE, Health and Wellbeing, have responsibility for implementing the Healthy Ireland strategy within the HSE, but in particularly our work is around prevention and early intervention. So looking at what Maria referred to earlier as primary prevention, actually. So our focus of our work is, and this project is particularly around trying to address health inequalities. I think most of us are familiar with health inequalities and the evidence that tells us the life expectancy by socioeconomic status is quite diverse. We also know that it's a very complex problem to try and address, and it's not the sole or entire responsibility of the HSE or any government agency probably, and it demands a cross-government approach. And I think that's one of the joys of this approach, that it's a cross-government approach, and it's an approach that's been adopted between the local authorities and the HSE. So, as I said earlier, it's a Healthy Ireland initiative. It's looking at addressing the wider health inequalities, but in particular looking at the wider social determinants of health and looking at the environmental impacts of health and trying to address some of them in partnership with the local authorities. And the responsibility for the HSE is around looking at lifestyle behaviours and supporting people around lifestyle behaviour change. The purpose of it is to improve the long-term health and well-being of the most disadvantaged communities in Ireland, and that's particularly important because it's focused on these areas and these areas solely so we can see an increased investment in trying to improve their health outcomes. I think what we know is that the health outcomes for people in the most disadvantaged groups in this country is not improving. So while the health outcomes for the rest of us is improving, it isn't just at a static stage. And this is a very targeted approach to try and support these people around addressing some of their health behaviours. It's a place-based approach focused on particular communities and areas, and it's looking at the wider impact and the environmental places where people live, work, play, in terms of how that impacts on their health and improving them as well as their health outcomes. I've talked earlier about life expectancy in terms of socioeconomic group, and I think the most important thing is that it's a cross-government initiative, and the services are being targeted and provided by the HSE local authorities in partnership with community and voluntary organisations. Looking at the guiding principles around it, we looked at we used the Health Atlas data and the PUBL indices and mapped the areas based on the highest level of deprivation, so anything below -10. And you will have seen from the earlier slide that Tala, I think it was somewhere between 17 and 27%, so very high deprivation areas. So that was the approach taken. The populations range in size from 9,000 up to 18,000 max. And we aligned them to the SICAP areas, so social inclusion, community activation programs, because there's already targeted approach through this at a government level. Any of the interventions that we're doing are evidence-based interventions, so there are already programs or initiatives that have been rolled out in the HSE, and they're also based on government policy, so addressing particular lifestyle changes. Partnership is probably the key cornerstone to this initiative. So not only is it a partnership between government statutory bodies, it's also a partnership with the local community and development organisations and with the communities themselves. That's the bedrock and the cornerstone of the initiative, and it's probably the only way that it's going to work, and it's the only way that we are going to see any significant change. And the other key aspect to it is that many of the initiatives are peer-led, so they're being delivered by people who live and work in the communities. And again, that's really important in terms of understanding communities and working with communities. For the first initial tranche, there were 19 areas identified, and that was based on funding in particular. I think when we mapped the whole of the country, we've come up with about 50 areas that we need to look at this targeted intervention, but given the amount of funding that was available in 2021, 19 areas were identified, and the investment is significant from a prevention perspective, because certainly in my lifetime, I suppose, I'm working in prevention, which is probably over 10, 12 years, there's never been any significant investment in a targeted approach, so that's really important. And 13 million have gone into the first stage of this development. So from our perspective, it's really important and it's really welcome. Nationally, as I said, there's a cross-government support for this initiative. So ourselves have been working with the Department of Health around the planning and scoping of it. We've also been engaging with the other government departments around their support on it. And then, as I said earlier, the two key local delivery partners are the HSE, looking at the health behaviour and trying to support people around health behaviour change and access to health services, and then the local authority around community development, community engagement, and trying to look at the wider determinants of health. For each of our areas, we've put a dedicated person in place, so the local authorities have a local development officer and the HSE have a Staunch Care Healthy Communities coordinator, and they're part of a wider local implementation group that consists of those statutory bodies reporting into the LCDC at a local level, so into the local authority structure, the local community development companies, and it's kind of that partnership approach. The core services that are being delivered by the HSE, as I said, they're all evidence-based services. And so smoking services, there's an individual smoking cessation person in each of the areas that provides one-to-one service. There's a weekend quit programme, which is a 12-week support group programme. I suppose the beauty of the services are that they're local and accessible and they're free, so there's free NRT and group support around the provision of those. The Healthy Food Made Easy is a basic nutrition cookery course that helps people to look at their diet, how to plan meals and how to shop. And again, that's delivered locally in communities. And it's a programme that's run over a number of weeks. and then to support that and to support the wider environment around looking at community food and nutrition and the environmental impacts of that on people's health and lifestyle. Community food and nutrition workers are being put in place this year. So they're working with the local community development groups and looking at trying to engage people around the food environment and how that's going to impact or is impacting on their health. Parenting programs are also being run in all of the areas, and really that's around, supporting people around parenting and supporting children where it matters most around that very early stage in life. It's been challenging, actually. It's probably the most challenging program to deliver at the minute, and I think what we're finding is there's probably some stigma associated with parenting or attending parenting programs, and getting people to understand that it's a course that's for all parents and it's to help all parents. So we're looking at probably changing our approach around the delivery of that, and some of the areas are trying to offer it in school, so when parents are dropping their kids off in school, that they might get them to pop in for an hour engaged. So it's really around trying to work with local communities around what might work within their area and how to engage people, and it's constantly looking at what we're trying to do, and if it's not working, then trying to do it a different way. Most people might be familiar with social prescribing and how it's kicked off in the last few years, and social prescribing is really around getting someone to support people around social connection and engagement, and it's been very active, I suppose, post-COVID, because what happens is you get referred into a social prescriber or you self-refer, and that person will talk to you around, what would you like to do, how would you like to engage, how would you like to connect in your local community, what activities you're interested in, and they try and connect them in. So it's really around social connection and trying to get people to be part of the community, and I think we're all conscious about, certainly since COVID, the importance of social connection and what that means in terms of our mental health and how that again impacts on our physical health. The Making Every Contact Count is the HSE Behavioural Change Programme, and this really is around getting health professionals to have a conversation with people that they encounter every single day in all of their practice around their health behaviour, and is there any health behaviour in particular that they might like to change or they might like support around, and then referring them to that service. So there's extensive support in the HSE around trying to engage clinicians. So there's an e-learning module, there's face-to-face training, and I suppose what we know is that lots of health professionals are uncomfortable about having conversations with people around lifestyle and lifestyle behaviour. So while smoking might be easier to talk about, sometimes alcohol, but certainly if we move into obesity and physical activity. So it's around trying to support our healthcare professionals to have those conversations, give them the skills first of all, and then getting them to have those conversations as part of every consultation. So that's really important as well. Looking at what's happening around the local authority, and so each of the areas were given seed funding to look at some of the environmental changes that could be made in consultation with the local community. So as I said, we're talking about small geographic areas, we're talking about very small populations and communities, and this is just one of the initiatives. So Johns Gate is it's an inner city community with 50 houses in Limerick, and you will see the before picture there. So we have a green patch beside the old city wall in Limerick that was used for antisocial behaviour, so drugs, drinking, litter and general rowdiness. And the local authority and the local community got together, and they put in a pathway. They put in a pathway. It's not expensive. It didn't cost a lot of money, but the community are very proud of it. It stopped the antisocial behaviour. People are now using it, and there's a value in the space and in living in that space. And that's probably just one of the simple initiatives that happened with that partnership with the local authorities. Lots of other initiatives have happened around, gardens, improving green spaces, walkways, playgrounds. So it's around talking again to the local communities and trying to improve the wider environment and doing small changes, not big things. Collaborative partnerships are probably the biggest, as I said, advantage around this work and how it works. So the partners that are delivering these initiatives on behalf of the HSE, it's all through grant aid agreement with Section 39 agencies. These are community and voluntary organisations that are already working in these communities. And I suppose I can't overstate that fact. So they know these communities, they know how these communities work, they know how to engage these communities, and these services are delivered locally within these communities, and that is probably the key element as to how it will work and how it might work. And that's the partnership approach that's really important. There are over 40 partners on board at this stage, and all situated around the country. The interventions are evidence-informed. Training is delivered to all the delivery partners in a standardised way, as well as resources. And it's about making sure that there's some authenticity to that model, because we want to ensure that what's been delivered is done in the right way, and it's trying to meet the needs of what we're trying to address. We've started gathering data. Naturally enough, you're not going to get any government funding without producing the data. So we're looking at engagement levels, participation levels, completion rates. But we now know that, we need to do an evaluation, and we're currently talking to the department about evaluating it. And that's for two purposes, really, to see if what we're doing is actually working and if we can measure outcomes and improvement in health behaviours, because that's what we really need to do. And if we can't, then we've got to do something different. And then to secure investment so we can roll it out to the rest of the areas. So looking at, getting government support to roll it out. I'm just going to show you a short video. Ray attended, he spoke at this launch, Clear Healthy Communities launch in Tala, and himself and two of his other colleagues here. So let me just run that for you, hopefully. And I
first heard about the Stop Smoking service while attending another course in Feathercairn it was called Heads Up. It was a men's group. Just something popped into my head and going, I wonder would I give that a shot, the quit smoking programme.
I stayed with it really for health reasons, because I was beginning to be scared. My breathing wasn't great when I was walking, and I just didn't feel good in myself at all. Now that I have stopped, my blood pressure is gone down. My doctors are quite pleased with it, and I feel much healthier in every way. When I walk, my breathing is much better, and I just feel good in myself.
Quitting smoking has given me a new lease of life, health-wise and family-wise. I could sit through a whole conversation for the whole night, not leave the table to go out. The benefits I feel in myself and in my body and the whole lot, it's amazing.
I continued on with it, and because I was getting the nicotine replacement therapy free, it suited me because I was attending Feathercairn at the time, so I could just drop in, have my weekly chat.
I really felt very comfortable, and I needed to stop smoking, and I got great support.
And when you have that support, it's great. The difference the last few months has made to me is unbelievable.
Like you do really notice it now financially. I do often say I don't know how I could afford to smoke. I couldn't now. I wouldn't even think about it now.
Nobody thought I was going to give up smoking after 40 years. They were all in complete shock. Went out, daughter was impressed. She was a sort of on-off smoker, so she quit as well. So she gave up them as well.
It's a big transition, and it takes a lot of getting used to. And not only that, it takes discipline. But it's up to yourself. At the end of the day, you have to say, what do you want?
I was able to go from the quit smoking to the healthy food made easy with my sister. And her and I really enjoyed that class, we really did. We used to look forward to coming to it every Thursday.
Every Saturday now is a healthy day for my mum, our neighbour and myself, so we go buy all the products, make it, and so we're eating healthier as well. So it's just constantly improving from one thing to another. Well, if I was to recommend it to anybody, the reason to do it would be health benefits. You're saving money. It's free, it's accessible, you speak to a person, every week. So it's totally different than trying to do it on your own. You have a bit of encouragement. You have somebody to talk to. You can ring them if you need to.
I thought that, this is going to kill me because this is all I'm going to be doing, and it has really made a big difference in my life.
I was very into swimming. Had a pool, swim in the pool every morning at 10 o'clock, and I could nearly do the length on the water. That's how good that was. I wouldn't have done that last year.
When I used to go to the course, then a very visual thing for me was the CO2 monitor. So I could blow into it and see the improvement on a weekly basis. I hadn't planned it, so it was a complete shock for me, and it was a complete shock for the whole family that they thought I'd never give up smoking, and I thought I'd never give up smoking. They could see the improvements in my health. I could see the improvements in my health. I have to say, it's great.
I suppose what's very interesting is the thing that matters is that the services are delivered in local communities. There's no blocks. They're delivered in local health centres, gyms, community clubs. They're accessible. They're free. They're delivered where it matters to people, and they're delivered by people who work with them. They're friendly, and they work. And I suppose, from our perspective, putting the Sláinte Care Healthy Communities programme in place is a foundation stone. It's the building blocks to try and integrate and build other initiatives on it. And it's beginning to catch the attention of other statutory and government departments, because everybody realises that this is where, if we want to try and tackle health inequalities, we've got to do it in a targeted way. We've got to, offering those services in Tala Hospital, people weren't going to engage. They're not going to engage, So, so that's probably the most important thing. Just around the wider Healthy Ireland agenda, there's been huge investment in recent years around supporting people and supporting their wider health. So looking at Healthy Cities and Counties coordinators, there's one in each of the local authorities. And again, there's seed funding provided by the department to look at, those wider initiatives around playgrounds, around cycle paths, around trying to put in lighting to facilitate people to walk or to cycle. So there's huge investment going in there. Healthy Ireland at your libraries, everybody's probably more familiar with the local libraries now, they're really engaged around supporting, accessing, holding events and looking again at health and how health and connection works. There's an Age-Friendly Ireland coordinator in each of the local authorities, again working with older people around improving their health and engaging them and keeping them engaged at that level. The Arts Council have recently put in an arts and health person into the local authorities to look at art and how art can improve our health and improve our mental health. And the HIV Fast Track Cities initiative is being rolled out in the 4 major cities across the country. So really there's a huge focus now around addressing health inequalities, looking at the wider environmental impacts of health, looking at what impacts on our health, and that collaborative statutory community engagement. And I'm going to leave you with that. I think you all appreciate it, that what surrounds us shapes us. It's really important. And good health of the population is a product of where we live, where we work, where we play, and a lot of it is outside of our control. Thank you.